Hi, my name is Holly Campbell, and I am going to go over the simulation that I just watched. This video had many behaviors that did not represent professionalism or compassion. More oftentimes than not, nurses have a heavy workload and are very rushed. It is times like these that things are missed and the patient is the one that suffers. To answer these debriefing questions, honestly, I did not see any caring in this video. I just saw a nurse who was rushed and uninterested in the patient's well-being. When Nurse Nancy noticed the patient needed education regarding the diaper changes, she did demonstrate how to change a diaper, but she did not follow up with the patient to see if that message was received. The behaviors I observed were the nurse not addressing the most important problem here. The patient had no home. Nurse Nancy venting to her colleague at the nurse's station is a violation of HIPAA and very unprofessional. Instead of disclosing the patient's personal information and health history with the nurse, she could have used that time to consult case management to help find a safe place for this young mom and infant. If it were me, I would respond by not interrupting the patient. It is important to actively listen to your patient. In addition, I would have contacted my case manager so we could find a safe place for the mom and child. I would get any and all resources that I had available for this mom. One thing that I've learned in my 10 years in labor and delivery is sometimes just sitting down at eye level with a patient and allowing them to speak while you actively listen makes such a difference. You can learn so much from a patient if you show concern and are actively listening without interruptions. The biggest priority in this scenario is the patient is homeless. We cannot discharge a patient with a newborn to the streets. This is where the nurse needs to be the patient advocate and find the resources to provide a safe place for this new family. Like I stated before, consulting case management will be my very first step. The patient seemed more interested in receiving narcotics at discharge than caring for her newborn. This was unsettling since she has a health history of drug abuse. We do not want the patient to be in pain, but we also do not want to enable them either. A prescription of Motrin should be sufficient for a vaginal delivery. This is the standard care upon discharge. As Nurse Nancy states, following up with her doctor if she needs something stronger would be more appropriate at this time. If the patient is open and honest about her drug abuse and is willing to get help, I would provide her with the resources such as free clinics and support groups. If she is willing to get help, I would send lots of resources her way, anything that I could find. Another resource that we have in our hospital is called the Ronald McDonald House. We have used this on several occasions. They have temporarily helped our vulnerable population, such as domestic violence and homeless patients. But ultimately, I would consult with my case manager and find the best solution for this patient. Our case managers are our biggest allies. Unfortunately, I've had several experiences like this in my workplace. A few things I have learned with this simulation are to be very careful while discussing any information around colleagues. It is a HIPAA violation to discuss confidential information to another colleague who is not involved in the patient's care. Even venting, this is a violation and could warrant fines and a loss of your job. I also would be mindful to not interrupt the patient. Let them finish saying what they're saying. Let them finish talking without an interruption. This shows compassion and that you are interested in what they have to say. It is important to not tell a patient you are busy. They do not need to hear this, and they certainly do not need to feel like they are wasting your time or not important enough for your time. Thank you so much. And again, my name is Holly Campbell, and this was the simulation video.